The UK government has announced a major and controversial shift in asylum-related travel rules, and it's already generating strong reactions across the country. According to BBC News, asylum seekers in the UK will soon be banned from using taxis for routine medical appointments. This policy change comes after a detailed BBC investigation exposed the scale and cost of long-distance taxi journeys arranged for medical care, with some trips costing several £100s each. This update aims to walk you through what the new policy means, why it was introduced, the exceptions still allowed, the rising cost concerns behind it, and the wider transport review underway inside the Home Office. By the end, you'll have a full picture of the changes, the reasoning behind them, and what to expect next. Starting with the central change, from February onwards, most asylum seekers will no longer have access to taxis for routine GP visits or hospital appointments. Instead, the government plans to direct individuals to rely mainly on public transport systems, buses, trains, trams, or other local services for basic medical travel. This is a significant shift from the previous approach, where taxis were commonly used, especially for long-distance transfers from hotels or temporary accommodation sites. A large part of the reason behind this change comes from the BBC investigation that revealed numerous long and expensive taxi journeys that appeared to be unnecessary. Some of these trips ranged between £200 and £600 for a single hospital visit, leading ministers to question whether the system was being managed efficiently. According to the investigation, drivers also reported situations where they were paid for journeys even when asylum seekers didn't complete or refused the trip. All these revelations pushed government officials to take a closer look at how transport resources were being used. However, despite the new restrictions, the government has acknowledged that certain vulnerable groups will still need special consideration. The new policy will include limited exemptions. Pregnant women who require transport for maternity-related medical care will still be allowed taxi use, provided their situation meets specific criteria. The same applies to disabled asylum seekers who cannot realistically take public transport due to mobility limitations, as well as individuals with urgent medical needs. These exceptions must be formally approved, and ministers emphasize that taxis should be granted only when absolutely necessary. The goal, according to the Home Office, is to create a system that remains compassionate while preventing unnecessary costs. The financial element is an important part of this story. The Home Office revealed that asylum-related transport expenses currently average £15.8 million per year. But critics argue the real cost may be even higher today due to the increased number of asylum seekers living in hotel accommodations. This year, over 36,000 asylum seekers are being housed in hotels, compared to around 32,000 earlier in the year. With more people spread across different regions and relocated frequently, transport demands have grown significantly. Reducing reliance on taxis is seen as a major way to cut down expenses that have been rising steadily. Another key component of the public debate comes from the BBC's findings about long-distance transfers. One reported case involved a 250-mile round trip that cost £600. When these kinds of trips are multiplied across thousands of people over months and years, the numbers quickly escalate. These revelations became one of the driving factors behind the push to reassess how asylum-related transport is managed. Many taxpayers, advocacy groups, and policymakers have expressed concern over how travel budgets have been used and whether they were being monitored properly. Alongside the taxi ban for medical appointments, the Home Office has confirmed that a wider review of asylum-related travel is still underway. This broader review includes non-medical journeys such as hotel-to-hotel transfers, which have become more common due to the frequent relocation of asylum seekers. With hotels now being used widely as temporary accommodation, transport costs have naturally risen as individuals are moved around the country for operational reasons. The government's aim with the ongoing review is to limit taxi use strictly to exceptional circumstances and tighten spending controls across the entire asylum system. This change also fits into a much broader picture of reform. The UK is under increasing political and financial pressure to manage rising costs connected to asylum housing, healthcare, and support services. With more than 36,000 asylum seekers placed in hotels, a situation many critics argue is financially unsustainable, the government is looking for ways to reduce expenditures wherever possible. The new taxi restrictions are being presented as one step toward improving efficiency within the system and addressing public concerns over high taxpayer spending. For many asylum seekers, the shift will represent a significant adjustment. Public transport can be difficult to navigate, especially for individuals who may not speak English fluently, may not be familiar with the area, or may be dealing with trauma or medical difficulties. Advocacy groups have already raised concerns that the new rule could create barriers to accessing essential healthcare. They argue that for some people, taking multiple buses or traveling long distances on public transport is unrealistic. These groups warn that such restrictions could lead to missed appointments, delayed diagnoses, or worsening health conditions. On the other hand, supporters of the policy argue that the previous system lacked oversight and allowed unsustainable spending patterns. They claim that the reforms will bring the system closer in line with what is expected of UK residents, who typically rely on public transport for medical appointments unless they meet strict criteria for additional support. Government ministers say the exemptions in the new rules will ensure that vulnerable individuals are not put at risk, while the broader policy ensures better use of taxpayer funds. In the bigger picture, these new travel restrictions highlight how the UK government is reshaping the asylum system to respond to cost pressures, political concerns, and public sentiment. With hotel numbers rising, transport costs increasing, and debates around migration continuing, transport reform has become another focal point within a much wider immigration overhaul. As the policy rolls out, more updates are expected, especially once the full Home Office review is complete. For those following UK asylum policies closely, this is a development worth watching, as it is likely to shape future decisions around housing, support services, and budgeting. That brings us to the end of today's update. If you found this information useful or have thoughts on the new policy, feel free to share your opinion in the comments. Thanks for watching, and stay connected for more UK news and policy updates.